The popularity of non-invasive procedures to help eliminate the signs of aging continues to grow each day. Right now, there are two products on the market that are among the most popular. So how do you know which procedure and which treatment is best for you? Dr. Sumit Bapna of Ohio Facial Plastics recently took part in a broad study to compare the benefits of each project, and he's joining me today to talk about the results. He also brought along Jackie Civic, who is an esthetician of patient care coordinator at the practice. Welcome to both of you.
Thank you, Gail. Thanks for having us.
How exciting to take part in this study. And I think that's really neat because they are so similar. Which two products, explain the two products you looked at.
So there's essentially two products right now on the market, Botox and Dysport. Botox, as we know, has been around for at least 9 years for aesthetic uses. Really in Europe it's been used for much longer. Dysport was initially FDA approved 2 years ago. And when it first came out, we looked at both of them and said, you know, how are we going to know which one works better?
And explain what they do.
So they both work by relaxing muscles. So we like to use them in the upper face. We like to use it around the crow's feet, in the frown lines or forehead lines, to decrease the appearance of the lines there. Both treatments last approximately 3 to 4 months. So patients do need to repeat them if they like the effect, which, you know, we rarely have patients that complain that they miss their lines. So
they want to continue to do this.
Exactly.
How did you get involved with this study then?
So the study originated in San Francisco, where I was doing my fellowship in facial plastic surgery. And nearing the completion of my fellowship is when Dysport was first FDA approved. So we sat down and said, how are we going to know which one's better? So we decided to design a study where we could compare both of them on the same patient. We looked at the crow's feet, which on the sides of the eyes, because there would be no crossover of the two products. If we injected the forehead with Botox on one side and Dysport on the other, it'd be hard to say that one's working better than the other and not some crossover occurring. So we looked at crow's feet for the study, and I think we're showing some pictures right now which show Dysport on the top and Botox on the bottom. This is the same patient. It may be hard to discern the difference in these pictures because they are shown on a TV screen instead of a smaller image.
Right.
Exactly. But in the study we enrolled 90 patients. One side was injected with Dysport, the other side with Botox. It was blinded, so both the physician and the patient didn't really know which one was which. And we looked at the patients for that first month. At 30 days is when these photographs were taken. So at maximal contraction, or when you're smiling or squinting, you can see on the Dysport side, there's better improvement of the lines.
And you're convinced, after doing the study too, that you would recommend Dysport?
I would, for most patients. Now, we only studied one muscle group. It's from this paper, from this study, we can't really say that Dysport works better for every patient in every area. Every patient is a little different. So medications work on patients differently. There may be some patients that Botox works better, and there's others that Dysport works better. It's really important to, when you're deciding to have one of these treatments, that you see someone that has experience in both, so they can tell you which one may be better for you.
And in fact, in your practice, that's where Jackie comes in, right, Jackie? You meet folks right at the beginning, and you kind of evaluate them?
Yep, absolutely, and kind of determine what the best skincare procedure for them would be.
Is that important for you to see and decide with that patient before anything's done?
Absolutely, yes. It's definitely important to do that. Yeah.
What does a consultation include then?
I kind of just assess the skin, ask the patient what their biggest concerns are with their skin. Typically it's fine lines, wrinkles, hyperpigmentation. And then we kind of go from there and determine what procedure would be best for them.
Doctor, if folks want to get in contact with you, especially because they know you've done the study on both and you might have a better feel for which one would be best for them, how do they get a hold of you?
Sure. They can visit our website. It's www.ohioface.com, or they could call us directly at 614-876-6673. Talk to Jackie or talk to someone else in our staff and book a consultation. We can sit down and really decide which one works for them better. Interestingly, right now, Dysport's running a promotion. It's called Think Outside the Box. So they want patients to try this new treatment. And until September 30th, if they have a treatment, they can actually save up to $100 if they've had Botox before and they're willing to try Dysport and see if it works better for them.
Doctor, thank you. Nice to have you here. Jackie, thank you as well.
Thank you.
Thank you, Gail.
Thank you.